Hello, my name is Lynn Zafke again. I'm an insurance broker. I wanted to take a little time and talk about Medicare Part B and what it covers. Now, Medicare Part B is different than the Medicare Part A. It is your office visits, it is your laboratory, it is your testing. So, MRIs, CAT scans, if they're done outside of a hospital setting, those are considered Medicare Part B charges. Also, Medicare Part B covers your cancer screenings, things like bone scans, mammograms, cancer screenings are all covered under Medicare Part B. And there's no charge for the screenings. However, there is for the office visit. So that's when things kick in or expenses kick in. The other thing about original Medicare, and we'll talk about original Medicare first, original Part B, is it has an annual deductible. Now, this year in 2016, the annual deductible is $166, and that deductible can vary from one year to the next. So I don't expect it to be $166 for more than just this year. And after that $166 is met, then it becomes an 80%, 20% plan. And most people are used to that. Oftentimes, our health insurance for under age 65 was an 80%, 20% plan. However, lately that has changed. But we think, oh, well, we can handle 20% of our medical costs. But there is no out of pocket limit with original Medicare. And so you think 20%. Well, what if you have medical costs that can add up to $80,000, $90,000 outside of a hospital? For instance, if you had cancer. Well, then all of a sudden you have to pay 20% of that. It can be a large sum of money. The same with day surgeries. Day surgery is common practice nowadays for different things, such as knee surgery, skin surgery. Uh, Day surgery is Medicare Part B. And so you would be paying 20% of whatever that day surgery might be. And that could be as much as $50,000, $60,000, depending on what they're doing. Hernia surgery can be over $60,000. So you would be responsible for 20% of that unless you have a Medicare health plan that goes with your Medicare Part B. Now, some services, like I said, are covered 100%, but your office visits are, such as your cancer screening, your office visits are not. If you're a diabetic, oftentimes those are only covered at 80%, 20%. And depending on if you have a Medicare Advantage plan, some Advantage plans don't cover 100% of diabetic costs. And so you could end up paying the out-of-pocket limit for a Medicare Advantage plan, which could be as much as $6,700 or $10,000 if it's out of network. So there's a lot of costs that come with Medicare Part B, and your Medicare Advantage plans oftentimes don't cover all those costs. And so that's why some people prefer a Medicare supplement plan that has a more comprehensive coverage. So if you have a chronic disease condition such as diabetes, where you're insulin dependent, oftentimes a supplement plan makes more sense. You know you're going to have higher medical costs than the normal person. So why not cover those costs? Yes, you'll pay a premium, but you can budget for your healthcare costs because you know what your premium is going to be and that the rest of your costs are going to be covered. Now, the other thing that Medicare Part B has is excess doctor charges. These excess doctor charges, Medicare allows a provider to charge 15% above what Medicare would normally pay. So if Medicare said, well, we'll pay $100, then the provider can charge an extra $15, and that's the responsibility of the patient. So sometimes those charges never show up. Other times they do. Usually it's with a private pay hospital. They're the ones that most often do. Sometimes it's just with, say, an anesthesiologist, uh, people that you don't normally run into. But there's something to keep in mind. Some Medicare supplement plans don't pay for that, and others do. So you want to ask those questions or have an agent that will explain it all to you. Now, my email is below my chin here, right here, and I invite you to email me if you have any questions. I do telephone interviews or online interviews where you'll be able to see my screen. I can't see yours. So your computer is safe. And if we do that, there is no charge for the first consultation or maybe the rest of them. And I can go over your Medicare healthcare plan and find out if there's one that may be better for you. My name is Lynn Zafke. I'm an insurance broker. I deal with all the different Medicare health plans available. So I make the plan fit your needs, not the other way around. Thank you very much. You have a good day.